Well, good afternoon, everyone. My name is Jeff Lofting. I am Director of Education for True Charity Initiative, and we want to thank you for joining the Compassion and Calamity webinar. We're very excited about the guests that we have and the information we have to share and to learn. So today we are going to be exploring the different ways that charities can respond to crisis situations in ways that meet the needs that come out of a situation like this, while honoring the individual's heart and the heart of God. We all have a desire. Those of you who are here, I'm sure you're here because you have a desire, you have compassion for those that are in need. And the crisis situation makes it a little bit more challenging, but it makes it even more necessary. Now, today isn't going to be a structured lesson. It's going to be a Q&A with two guests that we have joining, Dr. Marvin Olasky and Dr. James Whitford, who have a lot of experience dealing with and working with poverty in challenging ways. I wanted to talk a little bit about True Charity Initiative and the purpose, our purpose and why we exist. True Charity Initiative, for those of you who aren't familiar, exists to equip communities to practice effective charity and to be free from welfare. We, like I talked about before, we have compassion, and it can translate into effective charity or ineffective charity. And so we exist to help whatever role you serve. We want to help you to learn how to do that and ultimately help those who are in need rather than hurt, which is possible. And we do that through educating, connecting, and advocating for nonprofits, charities, and churches involved in charitable work. So you can learn more about True Charity Initiative at truecharity.us. That's truecharity.us. And we'll also be sending out a webinar resource file that'll guide you to more information about TCI, and then also some relevant resources that kind of come out of what we're talking about today. Joining us by audio only today is Dr. Marvin Olasky. And Dr. Marvin Olasky is the editor-in-chief of World Magazine, and he's also a frequent contributor to The World and Everything in It, which is by far my all-time favorite daily podcast. He's also the author of 20 books, including Tragedy of American Compassion. And this book has profoundly impacted our understanding of the history of poverty in the US, along with the potential pitfalls and also effective practices. It's also been foundational to our direction at True Charity Initiative, particularly the 7 marks of effective charity, which we'll talk a little bit about today. They were derived from that book. So thank you for joining us, Dr. Olasky. We really appreciate it.
Thank you, Jeff.
And then we also have Dr. James Whitford. James and his wife, Marcia, co-founded Watered Gardens Ministries 20 years ago, which is now a 50-bed mission in Joplin, Missouri. And it works with the homeless and the poor and meets about 20,000 needs every year. And they were also the recipient of the 2019 Hope Award for Effective Compassion from World News Group. And James is also the executive director of this organization, True Charity Initiative. So thank you so much for joining us, guys. We really appreciate it. And I understand, before we jump into the questions, I understand that you two have something in common in that you both have spent some time living among the homeless. So can you talk a little bit about that? What led you to do that, and what did you learn? So Dr. Olasky, can you tell a little bit about that first?
Well, sure. This goes way back about 30 years. I had spent 6 months in the Library of Congress reading about charity in the past and how homeless individuals were treated. This was now March in Washington, D.C., and the weather was warming up a little bit and a little bit crazy from social isolation in the stacks of the library. I just wanted to go out and see for myself how things work today. So I went out for a couple of days. My wife is very forgiving. I hadn't showered for several days, put on a couple of smelly t-shirts and stuff like that, put some tape on my glasses, took off my wedding ring for the only time in 43 years, and just went out on the street and went to one place, and from there asked, well, where can I get some food? Where can I get this? And spent a couple of days just wandering around to places in Washington, D.C. And what I learned was, number one, at that time, there was plenty of food available, plenty of shelter, not safe shelter, but shelter, plenty of clothes, medicine, all those things. But no one at the places I went to asked anything about me personally. No one brought up any spiritual questions. It was all material, with one exception. At one place, I actually had an interview with a worker there. And when I told him with my homeless mumble, well, I used to work at the DuPont company. I was a speechwriter for the chairman of the board. And I suspect he may have thought I was making this up, but this was actually true. And he said at this point, this was during the administration of George H.W. Bush, he said, "That's great. You've been a speechwriter. Maybe you can write speeches attacking Bush for not helping the poor."
Wow. 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 Well, yeah, that is an incredible experience, and I know you actually go into that in the Effective Compassion podcast that is linked on that webinar resources page. So I highly recommend those of you who are joining us to check out that Effective Compassion podcast. Dr. Olasky goes into even more detail about that whole process. So, James, can you tell us about your experience?
Yeah, and first I just want to say thanks to you, Jeff, for all the work on getting this podcast ready. Webinar, it's a webinar, but and it is being recorded. Is that right?
It is, yes, it will
Okay,
be.
great. Yeah, so it'll be accessible to others, and I want folks who are viewing today to know I might start taking some notes at one point or another as Dr. Olasky speaks. So it's quite an honor to have him with us today. Well, so yeah, I'm trying to think of when that was that I was compelled to go and live on the streets for a pretty short amount of time. I didn't know how long it was going to be. At that time, our mission, Watered Gardens, didn't have a shelter, but there was a need for one. Homelessness was pretty bad in our city, and I felt like God was telling me to go and live on the streets, um, and uh, and to fast and pray. And so, I did, and then God miraculously provided at the conclusion of that. And I don't have the time to get into that story, but it was just fantastic to see God's miraculous provision for shelter. And so we were able to start a shelter right after that. But during that time, I was listening to Dr. Olasky share a little bit of what he learned along the way, and I thought, gosh, I should probably remember what was the big thing I learned in those 10 or so days that I was homeless on the streets in Joplin. And I think it was the interaction I had with a guy named Ralph. The sun was going down. I hadn't eaten, but I think a donut that morning, and that was it. I was hungry. Ralph had a brown bag with a sandwich in it, and the sandwich was cut in two, and he said, "You want half of my sandwich?" And I remember my first thought, my first feeling was, uh, I'm typically that guy directing a mission, helping people, and so no, I don't want to take your sandwich from you. I mean, that's yours. I'll be fine. You're the guy that is in need of the sandwich. It was that type of thing. And then I was hungry though, and so as I said yes, thank you, Ralph. And I took half of that sandwich and we broke bread together on the streets that night. There was a real awakening for me at that moment, realizing that I had been guilty of treating people as simply the recipients of my benevolence rather than people who could also be a part in giving back. And that really was a big moment of change for how we practice charity today during that time. So
Right, right. And that's a major component of the principles of true charity, that we honor that those each individual's opportunity to contribute and to give, to provide what they can, and looking at what they can do. So thank you so much, both of you, for sharing those experiences. The vast majority of us have never had that experience, even if it was relatively short. But we know that your experience goes way beyond that, and so we're really looking forward to hearing from that. So let's go ahead and jump right into the very first question. We're going to look at the impact on giving and charities with this current situation. And a recent CNBC economic report stated that retail sales have seen the greatest decline ever, and industrial production fell the most since 1946. Those are pretty stark statistics, and some even predict the U.S. might enter a recession, if not a depression, as a result. And so, Dr. Olasky, if you could talk a little bit about how you foresee this affecting charitable giving, and I know that this is a tough question to answer, but any insight you have into that.
Well, it is tough. We don't know really what's going to happen as far as the continued spread of the disease or ways to stop it. But I can give you a macro and a micro analysis. The macro analysis is, it depends. There are big givers and there are small givers. Big givers who, let's say, have lost a lot of money in the stock market are going to feel poorer and they may not be so inclined to give. On the other hand, if they are big givers, they probably have a cushion and maybe they will still give out of that abundance. We hope. We can pray about that, but I would suspect there'd be some drop off. And then smaller givers who, from their weekly or monthly paychecks, give a little bit of money. Well, if they're not employed, they're not likely to give money. Now, there are provisions on employment insurance and other checks that are being sent out. So some of them may still give, but I suspect there'd be some drop off there. So I think on both those counts, macro and micro, big and small givers, there'll probably be some drop off. We don't know how much. But then on the level of individual charities, I suspect I know that some nonprofit organizations are using this time to help others and also in the course of doing that really advertise themselves. So there are nonprofit groups, charities that offer free access to their programs, their classes, their courses, research materials, Bible study materials. So insofar as people take advantage of that, then those people are learning something, getting something valuable, but they're also learning something about the organization, and they may give there. And then there are groups out right now delivering groceries to people who have tested positive for COVID-19, or there's an organization that matches medical workers with available RVs, so these folks in the hospitals and so forth can get some sleep while still social distancing, and they can avoid spreading the virus to their families. There's an adventure organization that offers resources for backyard campouts, that type of stuff. Organizations that are doing that, charities that are doing that, are helping others, but they're probably also going to be helping themselves, making people more aware of what they're doing and maybe soliciting contributions in that way. So on the whole, I think it's going to be hard. I don't know how much. For individual charities, this is actually an opportunity to let people know what you're doing, and then those people may respond.
Mm-hmm. Yeah, it's very important. In True Charity Initiative, we one of the 3 A's, the pillars, is that True Charity is actualized, that it actually does what it's aimed to do, and so there's outcomes, and those donors are going to be looking for those outcomes, right? They're going to be looking for charities that do more than just put out. There's actually outcomes, not just outputs, and so doing charity effectively is going to be a great way for others to be able to see, for you to get on their radar as a charitable organization. So, James, if you have anything more to add to that, please do. But the next question that we have is similar to that. How can charities adjust to meet the needs from increased unemployment and homelessness? That's definitely going to happen. It's inevitable in this situation.
Yeah, so I think that my first recommendation would be to get focused. So a lot of charities and missions like ours are doing a lot of different things to meet a wide variety of needs. But I think getting focused on what's the niche that we can fill in our community. And so for us, there were a couple of pieces, and it was meal delivery to folks who are quarantined, but also offering quarantine shelter for those who would be positive with COVID-19 and yet don't have a home to go and finish their recovery. So it was just a couple of things that we really decided to focus on. It's not that we're not doing some other things, but we did get focused, and I think that's really important. And back to something Dr. Olasky shared, I think it's also important to share what it is that you're doing. You know, share with your community, share with those that are involved with your ministry, keep in touch with those that have been partners, whether volunteer or financially, and let them know this is what we're doing, this is how we're getting focused. I also think it's really important to collaborate. So to understand what the niche is that a charity or a mission can best fill in a community, you really do need to know what other organizations and agencies are doing in the community during a time of disaster or calamity, as we've titled this particular webcast. But and so we're on a call once a week. I'm on a call with other agency leaders and hospital administration, and feeling out what are you doing, what niches are you filling, what can we best do to fit in. So I think that's really important. I also think it's important to what I would say call decentralization. So for an organization to not rely on one big grant to hire a bunch of help to accomplish whatever the need is, I don't think that's going to be wise for organizations in the future when need may increase from an economic fallout. And we need to work toward decentralization, or you might say diversification. So how can we really reach out to a lot of people in our community and have them involved in a variety of different ways, whether it's giving a little bit financially or volunteering once a month, and that kind of diversification is going to be very helpful when it comes time to meet more needs. So, and then lastly, I would say it's really important to hope beyond mere relief. So during times of disaster, people think relief, people need relief, but we've got to be hoping beyond mere relief. Just because a person might need food, or they might need clothing, or they might need shelter, they also need employment. They also need housing. They also need wellness, or to build their social capital. So there are other things that I think we need to be hoping for in the middle of that relief, which would drive us to think about how to meter or measure progress toward those things. And that's back to what you were saying in regard to actualized charity. Are we actually making that long-term impact in a person's life? Let's not abandon that just because we're in a time of disaster where there's a lot of relief that's needed.
Mm-hmm. Right. The book When Helping Hurts, which is a book that we would highly recommend at TCI, talks about the difference between relief, rehabilitation, and development, and kind of triaging that and the importance of that in a crisis situation. So is that person really in need of relief? Focusing on those individuals that are really in need of immediate relief, or are they in need of rehabilitation? And so dividing that out and categorizing it, which we'll actually get to in one of the questions that we have coming up. Real quickly though, I wanted to take a quick break and just let our attendees know about True Charity Summit that is coming up in September. It's our annual educational event. September 22nd and 23rd, there's going to be an evening session on the 22nd, and then a full day on the 23rd. And the theme is reclaiming justice, taking back a stolen virtue. And we know that God is a God of justice. Justice is what is right. And we know that there's a lot in the world that just is not right, and it doesn't align with God's original design. So that term justice has actually been taken and changed to what it originally meant in the biblical sense. And so that's an injustice in and of itself. But what we're going to be looking at is how compassion can translate to true charity, to work for justice for those in poverty, and those especially, there's going to be more of these poverty situations likely that are going to occur. So how do we jumps into more detail of how can we actually face those situations wisely. There's going to be some excellent speakers. We have as our general session speaker, our keynote speaker, Dr. Larry Reed. He's the president emeritus of Foundation for Economic Education. And then we'll have breakout tracks over a variety of topics: economic justice, historical justice or justice in history, social justice, practical justice, and then James will be leading a Foundations of True Charity class that's going to repeat all all 3 breakout sessions, so that those of you who want more information about the principles of true charity can go through that. So check it out, gotc.us/summit. And that's also on that webinar resources page that will be sent out afterwards. Okay, so let's shift over to the principle of exchange. 3 traits, Dr. Olasky, that are in your book, Tragedy of American Compassion, that are repeatedly demonstrated by effective charities historically, are that they are challenging, personal, and spiritual. And you mentioned that when you were talking about your experience living among the homeless. And within TCU, the True Charity University, which is our online learning platform, we teach about exchange, and we go into detail that this is a person that we want them to be a contributor and not just a receiver, because they do have something to give. And this economic downturn could turn into extensive unemployment. And as individuals that were made in the image of God to work, to produce, this can affect society in quite a way. Recent news article forecasted that unemployment could reach 26% in the state of Missouri. So the question is, how does being out of work or even temporarily laid off affect society as a whole? And what can charitable organizations do in response? So Dr. Olasky, if you could touch on that.
It affects it a lot. I think that's pretty obvious. God made us to work. God put Adam in a garden and right away said, you're in charge of this. Keep working at it. So it's really important, and people's physical condition and mental condition declines if they're just stuck at home and not able to have the satisfactions, but also the challenges of being out there. So as much as possible, when you're helping people in that situation, people who are very competent and capable, they're out of work through no difficulties of their own, just societal difficulties, disease, and so forth, you want to help them be and stay in good shape by doing some work. So if, let's say, you're feeding a family and one of the adults is capable of delivering food to others, then yes, you do an exchange there. You are feeding the family. They are delivering groceries to people who can't get out of their homes. In World, we had one report on a person in England who gets his daily exercise by walking 5 miles a day delivering food. So this is good stuff. You have an exchange principle. If people are competent and capable, providing childcare for, let's say, medical people who are on the front lines, or truck drivers who are on the road delivering goods to others, then if people have to be trustworthy, competent, capable of good records, but those folks then in exchange are capable of providing childcare for others. A person who has a driving license and a good record, well, he can give people rides to places where they need to go. So as much as possible, we always want to find out how capable are the people who come to our doors, what can they do, what are they able to do, what are they willing to do, and we're not creating slaves or servants here, except for public servants. We're helping people to help others, but also help themselves at the same time. So that should be our principle. Sometimes you can't do it. There are people who are mentally and physically unable to act in those ways, but anyone who can, you want to think creatively. What can you do to help this person and help that person help others, and in doing that, help himself or herself as well.
Right. Yeah, we talk a little bit about in categorization, the next topic that we're gonna look at, a function based, and as you mentioned, Dr. Olasky, looking as a charitable organization, or even as an individual that is working alongside someone who's experiencing poverty or need, looking at what they are able to do and what they have, rather than looking at what they don't have and what they're not able to do, and empowering that individual by helping them to see how that can actually contribute. James, I know that you have said before that when we see a person on the corner that's holding a sign or flying a sign, as it's called, and it says, will work for food. Our first instinct is to just give them money, right? But what is your response to that?
Yeah, take them up on their offer. That's what I like to advise people. If they say we'll work for food, do the best you can to take them up on their offer of that. And I think that we are looking at 30 million people, I think, right now have filed for unemployment, and so it's a huge issue. But just because people are unemployed or without a job doesn't mean that they don't have the ability to work. And I think we've just got to make sure that we're remembering that. And I was recalling another disaster. I think about 10 years ago, Haiti had their massive earthquake. I don't remember how many people perished in that. I want to say it was somewhere like 600,000 or something. It was a huge, huge number. And I was still practicing a little bit at that point as a wound care specialist, and was called into action in Haiti about 30 days after the earthquake. Um, and of course, there was a great need for relief. I mean, you talk about calamity. I mean, it was certainly that. And yet there were many, many people that took advantage of a lot of folks like me and others that were coming in to help, and they were starting up these small enterprises, selling trinkets or pieces of art. Or I remember buying an entire cooler full of frozen popsicles. I don't know. He literally put them on a little dolly and was dragging them down a dirt road, trying to sell these frozen popsicles. I was glad to buy the whole cooler. It was an incredibly hot day that day, and boy, was he excited. And that's the thing that I think is really important to remember. All of the people that I ran into there who were involved in trying to sell whatever it is that they had, they were involved in exchange. They were more vibrant and more energized and happier than some of the people that I know right here in our hometown of Joplin, who are poor but have more in material wealth. And yet they're sadder. In fact, I remember coming back from Haiti, and as I entered in the foyer of our mission on my first day back, there was a guy named Dave sitting in the foyer. He had just gotten subsidized housing, and he was also had a subsidized cell phone. And I remember thinking he's more sad and depressed than some of the folks that I just met in Haiti. And so that sad depression, that happens during unemployment. And I would love the viewers today to remember this journal article. It's from the Journal of Applied Psychology in 2015. They published an article called "Changes in Personality with Unemployment." I think that was the name of the article, "Changes in Personality with Unemployment." What a good article for all of us to look into. It's not that old, 2015. They looked at 6,000 adults who were unemployed for at least a year, and they found that if they were unemployed for a year on unemployment, but so they had their needs met, but if they weren't working for a year, there was a statistically significant decline in 3 of 5 psychosocial metrics: openness, agreeableness, and conscientiousness. And just think about that. That's the potentiality for 30 million Americans. If we don't get back to work, they become less agreeable, less open, and less conscientious. So what can charities do in the middle of all of that? Well, I think it's what Dr. Olasky was saying. With as much as is possible, we want to enter into partnership with people. Even though there's a great need for relief, we should be thinking about how can that person be a part of this situation and meeting their own need. How can we engage in reciprocity with that individual, help them retain a sense of dignity? And again, it lifts the spirit. We know that. So really important. I think the last comment I would make here, maybe just to give our viewers some things to jot down that are important to remember. Robert Lupton, in his book, Toxic Charity, goes through 5 steps to dependency. And I think it's very important for us to understand that during times of disaster and calamity, there is an increased need for and distribution of relief. But with as much relief that goes out, there's an equitable risk increase that people become dependent on relief. Here are his 5 steps to dependency. He says, if you give something to somebody once, they'll appreciate it. But if you give it to them a second time, they'll have an anticipation that you'll do it a third time. The third time, they'll develop an expectation. The fourth time, they'll become entitled. And the fifth time, they'll be dependent on you for it. So the 5 steps are appreciation, anticipation, expectation, entitlement, and dependency. We have a moral obligation in a time like this to make sure that we are not marching people into a dependent pattern of living.
That's very good. Yeah, I mean, we do have a responsibility. You know, a lot of times it feels good to just give, but we have to discern what is the impact of our giving, and how does that kind of step somebody up into the steps into dependency, and then how does that step us up? I know you talk also about the steps of paternalism, and so that's another interesting topic to look at. Now, I will send out to attendees, to you who are viewing, that the Journal of Applied Science. I'll send a link to that so you can look more into that. So we kind of are going to talk about, you've talked a little bit about what can charitable organizations do in response, but something that also goes along with that is what's called categorization that charitable organizations can participate in or practice. And it's part of one of TCI's 3 core elements to be accurate in our charity, that we're aiming at the actual need or the actual cause of this person's need or poverty. And so we have to become personally involved with the individual. You can't it can't be charity with tongs, as organization back in the 1890s said. It sounds very similar to a lot of what we do today, charity with tongs. And so it's figuring out, as we stated before, what the individual has, is able to do, rather than what they're not. So they're challenged through exchange, but there are some that are genuinely in need of immediate relief, and who truly can't provide for themselves while others can, to a certain degree. So it requires what's called categorization, and it's a very time-consuming process. So Dr. Olasky, could you talk a little bit about what categorization is, and whether it's still possible in situations of large-scale need?
Well, sure. And actually, it's probably easier during our coronavirus crisis than it was formerly, because the number one distinction you have to make, rather than one size fits all, you have to think, who's in this situation because of situations beyond the person's control? Mm-hmm. And the person has already demonstrated a good work ethic, willingness to help his family, all those good things. The person has already shown that. That's one type of person. Another type of person, again, I'm looking at this in a very basic way. Another type of person has a whole record of irresponsibility, perhaps out of very significant character flaws, perhaps out of mental illness, perhaps out of a lot of things, but the person has not shown that ability to work hard and conscientiously. So if you help materially the person who has been conscientious, who basically has good work values, and that's likely to be actually very helpful to that person in time of crisis. On the other hand, if you have a person who has the mentality of just being a taker rather than a giver, that person is going to go through those stages that Bob Lupton talks about. So I'm not sure his 5 stages are exactly the same for everyone, but for a lot of people in poor circumstances, he has shown over the years, Bob has, that he knows what he's doing, and I would go with those 5 stages. So you have to be very careful, as he is, with a lot of people. But on the other hand, if the person has good work values already, then I think you can go ahead and give in a crisis without creating that dependency and creating a bad set of attitudes, building a bad set of attitudes in that person. So that's the primary thing. Is the money, the resources you give, going to help the person or hurt the person? And a lot of that depends on the values of the person. And then a second thing is, going forward, what as best you can see, and this requires learning a lot about the individual. What are that individual's plans? What are the goals? Again, are you going to be helping rather than hurting? Those are the crucial things involved with categorization. And a lot of people don't like to do that. A lot of people say, oh, we're supposed to give to everyone. You are distinguishing between people on a non-biblical basis. Well, that familiar passage in Matthew 25, where Jesus talks about, as you do to the least of these, you do to me, it cuts both ways. If you are giving money to a person who is likely to use that money for drugs or alcohol, then it's like you are sticking heroin into Jesus's veins. You're hurting him. And that's something we're commanded not to do. So as much as possible, we need to try to make those distinctions in a way that's loving and not cruel. And again, that's hard also. But these are hard things. And we're called as much as we can to give not just some money, but also our time.
Yeah, very good. James, do you have anything to ask
Well,
about?
yeah, I might just say a couple quick things. People are not created and through a cookie cutter, right? And so we can't meet needs by a cookie cutter either. And so I don't know that you used the terms, but you were referring to this earlier, the idea of what I call dysfunctional based categorization versus functional based categorization. So I think it may be good for the viewers to note there are two different types there that we look at. Dysfunctional based categorization is what we see too typically in our nation today, and it looks at categorizing a person as worthy of relief based on what they can't do, or how poor are you, how broken are you, how sick are you. So this is kind of the means tested way of finding out, well, this person obviously, falls below this particular poverty line, and therefore this is what justifies categorizing them as in need of relief. But there's functional based categorization, which is completely different. Rather than asking what you can't do, functional based categorization asks what you can do. What are your abilities? How can you be involved? And implied in that is what Dr. Olasky writes about in The Tragedy of American Compassion, that was very common in the late 1800s, work tests. So implied in the question, what can you do, is a work test or some sort of test or investigation to determine a person's willingness to help him or herself. And again, I think we have an obligation to look at that. Closely tied to that is the idea of discernment, right? That's another principle of true charity, is discernment. But how do we discern the things that Dr. Olasky and I are talking about right now when there's great need? Maybe 30 million people are unemployed. Where does that go? How can you be that careful at that time? And I think I just want to give you a quick example of how you can do that. So consider the differences between a single injury to a person, say a gunshot wound. Say a person has a gunshot wound to the abdomen. They're rushed to the ER. They get into the surgery room. There maybe are a couple of nurses. There's a surgeon. Maybe there's a chaplain. And there's a lot of people going to work to do just what is needed for that one individual to save his life. Now compare that to a movie I just saw called Last Full Measure, a story of William Pitsenbarger. William Pitsenbarger, who was an airman in one of the hottest conflicts in the Vietnam War, and a true story about him rappelling out of a helicopter, and he was a medic. And the army soldiers on the ground are just getting shot up. I mean, it's a horrible situation. And he rappels down, and he begins to care for those individuals. And in fact, he continues to send the chopper away, ends up staying and paying the last full measure. So he actually died in that conflict and received the Medal of Honor 34 years after that, I think. But the point is, during that time, he still had to find out where is the wound. What's the severity of the wound? What's the best quick plan of care for that individual? I have to discern, even in a situation like that, when there are a lot of gunshot wounds, I've got to play two nurses, a physician, and a chaplain all at the same time. I'm going to have to find out what's the real need right here, that I can apply the right bandaging, the right compression, the right tourniquet, and then move on to the next person. By no means could we say that just dumping out cases of gauze from the helicopter with a bunch of bottles of morphine and then flying away would be an answer to meet the needs of those individuals. So I think we've got to do what we've always done. We just pick up the pace a little bit.
Right, right. And I know you said before that the large scale need is just a lot of small needs, small scale needs, individual personal needs in a large scale, and so they're very different. They're very, very different. And so categorization, as Dr. Olasky mentioned earlier, it becomes even more important, and I think it's even more possible to do. Now, I wanted to touch real quickly on True Charity University. It actually is a perfect segue to it. We actually talk in detail about the 7 marks of effective charity, which you've been hearing all about: bonding, categorization, exchange, discernment. And within one of the courses, the categorization course, it talks about practical ways to practice categorization through tools like the SWOT analysis, where you're actually determining what they are able to do. And so you can access that at university.truecharity.us. We go in depth into each of those 7 marks. And right now, we are offering the first 2 courses, affiliation and bonding, for free, completely free, no cost. And then there's also a steep discount for the remaining 5 courses of the 7 marks. So definitely check that out. Those of you who are out there, university.truecharity.us, and learn more. And you can also find that in the webinar resources document that we have. Let's move over to the role that those that are not involved in full-time ministry or charity can play. 46% of those registered for this webinar that are out there identified their primary role in charitable work as a church member or a charity or nonprofit volunteer. So they're not in full-time charity work or ministry. And there's a quote from Tragedy of American Compassion that really has stuck in my mind, and that is that there are no shortcuts in fighting poverty. There's no good substitute for personal contact. And so whether it be charity workers or those who are not in full-time charity work or ministry, what can we do to maintain that personal contact, whether it be physical or not? I mean, right now maybe we can't do that. Hopefully that's going to end soon. But how do we go about still serving others, the organizations on the front lines of poverty fighting, or even just those who are suffering from poverty? Dr. Olasky, do you have anything to say about that?
Well, sure. It's hard right now to have that personal contact when a lot of us are socially isolated, or at least keeping more than 6 feet apart. But I can give you several examples of things folks have done to help out, not requiring that personal contact. Once from West Virginia, there were several people in a church who decided that they could and they did spend Easter Sunday making masks and other equipment for local healthcare workers. This was just something a couple of people did. Didn't require a whole lot of skill. Requires more skill than I have. My wife has made some masks. I'm incompetent, but these folks in West Virginia did it, and that was very helpful. If you have some special equipment, again, let's say you have an RV. In March, a couple of moms in Texas set up a thing called RVs for MDs. And they, as I mentioned earlier, they matched medical workers with available RVs for free. So people who are on the job could catch a few hours sleep in there and be isolated from others at that time. So, that requires a little bit of skill, a little bit of stuff. Some require more talent. We ran one story from Norfolk, England. There was a 21-year-old music student, and he wanted to raise some money for a mental health charity in England and Wales. And so he played the piano for 24 straight hours. And apparently, I hope he had some talent on it, or else he would create more mental illness from cacophonic sounds. But assuming he was a good player, he was saying, I'm going to raise money in this way. And then also music is very useful, helping people facing anxiety and depression because of coronavirus. So this person had a special skill. And then something that's a big special skill that I think was delightful for some people in Switzerland. There was a Swiss light artist, someone who knows a lot about how to set up lights and so forth. He was actually lighting up the Matterhorn, that famous mountain in the Swiss Alps, with different images every night, including flags of various countries. So he recently put up the flag of Singapore, since they're having a lot of coronavirus cases right now, illuminating the mountain. You can go online, you can actually see it. It's pretty cool. You can actually see at the flat face of the Matterhorn, this huge flag of Singapore, and he's on flags of other countries, including the US flag, I want to point out. But anyway, those are just some examples of this is distance, but it's not charity from the tongs in a way that people talked about in the 1890s. People are helping in ways you can help when you can't actually get up close and personal with someone in need.
It's good. It's good. James?
Well, let me say one quick thing that occurred to me earlier today. We talk often about organizations helping people. Truthfully, that never occurs. Organizations don't help people. People help people. So I'm thankful for folks who are making masks, but the masks do need to be worn by somebody who's willing to get close. And so I think that's very important to remember. There always will need to be that face-to-face charity that occurs if we're really going to be helping people. And I'll stop there.
Yeah. Okay. Great. Well, let's go on to we talked about the role of the individual. What about the role of government? That's a big question that a lot of us have, whether we're involved in full-time charitable work or not. And so one of the core beliefs of TCI is authentic. True charity is authentic. It springs from compassion, not compulsion. So taking tax money from me and giving it to somebody else, choosing who to give it to, that's not compassion, that's compulsion. Taking from me, it's personal, not passive. And so again, we've talked about the relationship, how important that is. That's challenging, but that's effective charity. And so we believe that charity should be privately funded. So James, are you able to talk a little bit about the pitfalls that could be connected to both individuals and organizations taking government money? And we'll need to transition pretty quickly to the questions that we've been posed. So if you could talk quickly about that. I know that's a big topic to try to talk about.
It is a big topic, and the list is a very long list. But I think the first thing that came to mind in regard to this question has to do with crowd out, the crowd out effect. So whenever we're taking government money to get something done, there's almost always some more local, closer to home, more compassionate response that is getting crowded out. And so I just feel like it's incredibly important before organizations take money from the government to try to get something done. Ask yourself, if that money wasn't coming, if the government wasn't there to step in and give this to me, what would I do? What would we do in that circumstance? And if you really play that out, you'll probably come up with some very creative ways to continue to do ministry effectively, continue to help the poor in your area without taking it. And again, sometimes the pressure, the drive to be creative and to press on in that regard is relieved of us when government steps in. And so again, I think there are more compassionate, personal approaches that are crowded out as soon as the federal government comes in and wants to give money to people. And of course, let me just also say that from a more personal, local level, I was just talking with a guy at the mission the other day. I said, so when are you getting stimulus money? He said, yeah. I said, what do you think is going to happen with stimulus money as people around here get it? And he said, I think a lot of people will buy dope. Those were his words. But we're dealing with people who are struggling with addiction issues. So again, for the government to just do indiscriminate giving, where they're going to give, it's that cookie cutter approach, right? People who are struggling with addiction issues or gambling issues, or they're going to stimulate the economy in a bad way, maybe even stimulate the dark economy in some horrible ways. So it's just one of many pitfalls that are possible.
And it definitely binds the hands of charitable organizations to do what we've talked about, categorizing and trying to determine what is that individual's true need, what do they have to give, what do they have to offer, so that there is that reciprocity. It's very, very important. And then briefly, Dr. Olasky, the role of government in crises or disasters. We've talked about the pitfalls of receiving government funding on a personal or an organizational level, but the role of government in these crises or disasters, is there any way to really understand what their role is?
Well, their role should be not supplanting private and voluntary organizations, but coming alongside them, helping them, getting red tape out of the way, and so forth. We can be a little more elastic in a flood, in a hurricane, or a coronavirus situation than we would be regularly. Allowing some things in cases of emergency, but I think after Hurricane Katrina 15 years ago, we learned that actually the private and business and volunteer organizations are a lot more efficient than government. So I would just second what James had to say about crowding out. In economics, there's Gresham's law, bad money drives out good. A couple of people have referred to Olasky's law, bad charity drives out good, but I'd be glad for it to be Whitford's law. He can take it over.
It's very generous of you, Dr. Olasky.
And this is recorded, so
exactly. There's proof of that. Well, thank you so much for answering those. Some of those were submitted by attendees, and so I think that was incredibly helpful to our attendees from different roles within society and in serving charitable needs. So right now I wanted to spend some time, the last 5 minutes, on an open Q&A. Again, there's not a whole lot of time, but fortunately we're able to get some questions answered that were submitted by participants. But one that came in was about how local organizations can work alongside national organizations. So this isn't federal assistance. This isn't a federal agency, but national crisis organizations that come in during times of disaster. How are local charities able to work with them, and it be more practicing of the principle of subsidiarity, which you might talk just briefly about. How does that dynamic work?
Well, I can just speak experientially from the tornado that Joplin, suffered in 2011, and that disaster. And there were government agencies that came into the community that did crowd out some things. And so it's hard to answer that question. How do we work alongside? It really is more the responsibility of a very powerful, centralized federal government in exercising its responsibility to not incidentally or accidentally crowd out or push out things that have already been established in a local community, collaborative efforts that have been already established, connectedness that's there, different tools that are already at play that help collaboration succeed. It's very easy for that to be drowned out by a large centralized power that comes into your community, or at least from the federal government. So to me, the way that works together is the responsibility of the federal government really respecting the principle of subsidiarity, that it should be the smallest, most local entity or organization that's caring for people in need before the federal government is involved. Very hard when politicians and many in the federal government are very excited about how much they can do to help. And so, but that we can all be guilty of that. It's not just a government thing. It can be a charity thing, right? We can be so excited to help, we don't let a person help him or herself. So we've always got to be thinking about subsidiarity starts with the individual and then the family, the local community, long before the state or federal governments are involved.
Mm-hmm. And it also applies to those national organizations. So those national organizations understanding the principle of subsidiarity is very, very important. Again, subsidiarity, one of those principles that you can learn more about on True Charity University. So highly recommend visiting that. There were a couple questions that we didn't get to answer. We're on our last 2 minutes. We will work to answer those questions. So if you submitted a question that didn't get answered, we'll reply with an answer, and please feel free to engage us in dialogue regarding that. We would love to hear back from you. If you have any questions whatsoever, please find us on social media and like us on those social media platforms, and send us messages. Contact us. Look up the truecharity.us website, and we would love to engage with you and to walk with you to develop effective practices of charity. And so there's a couple things, or 3 things, that we would really ask that you would take away from our time this webinar. First of all, we would highly encourage you to enroll in True Charity University at university.truecharity.us. Again, those first 2 courses are free, and then there's a steep discount on the remaining courses. And we've had some great feedback on that and really changing practices in a positive way. So we highly recommend that. If you are a charitable organization that is not currently pursuing True Charity certification, check out truecharity.us/get certified, and it will explain the process of certification. Contact us if you have more questions about that. And then, like I mentioned before, like us on social media. That webinar resources document, the link is there on your screen. Go tc.us/resource sheet. It has the links. If you click on the respective social media icon, it'll take you to our social media pages. So thank you so much for those of you who joined us. Dr. Olasky, James, thank you so much for the wisdom that you were able to share. And we hope to do this again. Thank you.
Thanks, Jeff. Thank you, Dr. Olasky.
Thank you all. Keep up the good work.
Thank you.
Have a great day, everyone.